Hello friends, I am Dr. Vijay Prakash and today I'll be talking to you about a new topic, that's overdentures. Now what do you mean by overdentures? Overdentures is basically preserving the teeth, that is you're having few teeth in the arch and you want to preserve them teeth and make a denture over that. So that is an overdenture concept where it is defined as a removable partial dentures which take support from one or more teeth, that is the natural teeth, or they can be roots or implants, so it can be anything. So we call overdentures by number of names, that is they can be called as biologic dentures, they can be called as telescopic dentures, they can be tooth supported overdentures or implant supported overdentures, they can be types of superimposed dentures. So these are all overdentures synonyms. Now, one thing which we have to keep in mind is what is the rationale behind overdentures. The rationale behind overdentures is that you are preserving bone. That is very important. With natural teeth, you are preserving bone. Secondly, you are preserving the proprioception. That is, you are preserving the very important aspect, that is the periodontal ligament. And with that, you are preserving the proprioception. Thirdly, you are preserving the patient can maintain the vertical height, and also the patient knows about the occlusal thickness. That is much better in an overdenture case than in a case of conventional dentures. So that is rational. Now, one thing which is very important where overdenture is described is preventive prosthodontics. Now, what do you mean by preventive prosthodontics? Preventive prosthodontics is basically reducing the need for prosthetic treatment or eliminating the need for prosthetic treatment. That is, say for example, in an overdenture case, you are having some teeth which are not of that great prognosis. You know that they should go for extraction, and the patient wants to preserve those teeth, and you feel that if you can give some option to the patient which can preserve these teeth, that will be great. So that's where overdenture comes into picture. You are basically reducing the crown root ratio. Now if you are having a tooth like this and you are having, say for example, the bone level is till this place, so the teeth are not that moving, you are having a okay prognosis wherein you can take support from these teeth and make a partial dentures. But say for example, the bone support is here, that is you are having an uneven balance of crown root ratio. So in those cases, if you reduce this height and make an overdenture over this, you can preserve the vertical height, you can preserve the teeth. One thing is this, that is you are preserving bone with overdentures. That is, again, when you are preserving the teeth, you are basically preserving the bone. Secondly, you are preserving with the teeth, you are preserving the periodontium. So with the periodontium, you, as you know, you have great amount of proprioceptors in periodontiums which maintain the teeth in the socket. Also, proprioceptors are found abundantly in the adjacent bone and the mucosa. So if you are preserving the teeth, you are preserving bone, and secondly you are preserving the proprioception. Thirdly, what you are preserving is you are preserving this vertical height. That is, when you are preserving the teeth, you are also preserving the vertical height. The patient is much more comfortable with the natural teeth than if you extract all the teeth, because once you extract all the teeth, there will be a rapid resorption of the bone. When there is a rapid resorption bone, the patient loses the bone, one. Secondly, he loses the proprioception. Thirdly, he loses the vertical height. So you are preserving the vertical height and also the occlusal thickness. So anything which comes in between the teeth, if the patient is wearing a conventional denture and the patient is wearing an overdenture, he will be in a better position to detect the thickness of the food in case of overdenture in comparison to a conventional dentures. So this is the concept where you are having the preventive prosthodontics into picture, where the rationale behind preventive prosthodontics, and overdenture is a concept which you can relate to preventive prosthodontics. Now, what is requirement of the overdentures? Now, what are the requirements of overdentures? One is when you are preserving the natural teeth, so there are very few teeth in the arch, and most of the teeth are of they are grade 1 mobile, or they are not having that great good bone support, but you know that they can work. So that means you need to reduce and make a favorable crown to root ratios. That is, if the bone support is in this level, then you need to reduce the tooth so that the mobility is reduced, less amount of torquing forces, because when you reduce the lever arm, when you are reducing this lever arm like this is the lever arm and this is the center. So if you are reducing the center and making it here, you are reducing this lever arm. So when you are reducing this lever arm, you are basically reducing the amount of torquing force on the natural teeth. You are preserving the amount of you are preserving the teeth, and you are also preserving the amount of bone. Secondly, when you are making an overdenture, the other rest of the basal sheet should be well healed. It should not have recently extraction sockets. Even if you have a recently extraction sockets, you can still make an overdenture which is immediate. Immediate overdentures is one of the overdentures you can make. Then you have to change the dentures and make a transitional or the definitive overdentures. Third is the dentures which we are making, they should be easy to fabricate. Fourthly, whenever possible, avoid the natural tooth. That is, avoid making an overdenture over the bare tooth. You always cover it with some kind of coping. That is a metallic cast coping, or some kind of attachments you can give to the in the root portion in order to have a good retention of the overdentures. Then it should be easily manipulated by the patient. It should not have, you have to keep in mind about the path of insertion and removal of the prosthesis. So it should be simple. It should be a single path of insertion and removal. The patient should not have problem while inserting and removing. If you find there are number of undercuts in the in your case, then make sure that you first treat those undercuts. That is, if you are having a severe undercuts, then make sure you do some kind of pre-prosthetic surgery and make sure you have a favorable undercuts. You can survey your cast and find out whether you are having favorable undercuts or not. If you want to know more about surveying, you can go to my channel and you can go to my video which is on surveying. I'll put the link in my this video in the description. You can go through that. So these are all the requirements of overdentures. Next is classification. Now, what you mean by the classification of overdentures? Now, they can be classified on the basis of the abutment preparation. So if we have the abutment preparation, they can be a non-coping where you are taking a bare root. They can be copings, or you can use an attachments. Second classification is on the basis of the mode of retention. They can be on the basis of retention, can be on the basis of copings, on the basis of attachments. They can be there are number types of attachments which we are going to discuss. They can be on the basis of sleeve coping processes, or they can be, you can derive retention from the submucosal vital root. And next, retention can be on the basis of implants. When you are placing an implant, you can take a implant supported overdentures. You can make a implant supported overdentures. Third is on the basis of time frame, like when you are making the overdentures. They can be made, you can make an immediate overdentures. Secondly, that is, immediate overdentures means immediately after extraction. So you can give an immediate overdentures. Secondly, after, they can be transitional overdentures. And thirdly, they can be trailing overdentures. Fourth, on the basis of tooth supported. So they can be tooth supported conventional dentures. They can be tooth supported immediate overdentures. On the basis of design, they can be classified as I told you on the you are taking support from the bare root, which I will advise not to take support from. Secondly, you have the telescopic, that is, you are using copings. you can use that is overdentures, telescopic overdentures, and thirdly attachment fixations. So all these are classification of overdentures. Next, the advantages of overdentures. Advantage, you know that there are basic advantages of an overdenture. One is you are preserving bone because you are preserving the natural teeth. Definitely you are preserving the bone. Secondly, you are preserving the proprioception. I already covered that in preventive prosthodontics. Since you are preserving the tooth, you are preserving the periodontium, so you are preserving the proprioceptors. So you are preserving proprioception. Thirdly, since you are preserving the tooth and reducing the crown root ratio and reducing the lever arm, that means you are providing a stable static base wherein you can have a good retention and stable dentures. Fourth, you are increasing the amount of retention because you are preserving the bone. You are taking help from the teeth. That is, you can give a coping, and over the coping you can make a overdentures. Fourthly, it is an inexpensive approach, especially in cases where you are having partial endodontia. That is, say for example, the patient is having congenital problems like cleft lip and palate or amelogenesis imperfecta. So in those cases, that's an inexpensive approach wherein you can just convert it into an overdenture. Fourthly, you have a better patient acceptance because the patient knows that there is a preservation of his natural teeth or even roots. So the patient is happy because he is able to have his own original teeth. Next is the patient can maintain good health of the periodontium. The patient can have can have reduced amount of periodontal problems. Easy to convert to a complete denture. Say for example, if the patient the root or the tooth cannot be restored further, even on overdentures, it can easily be extracted and the overdenture can be easily converted to a complete dentures. Next is horizontal or talking forces are reduced. As I told you, if you are reducing the lever arm by reducing the crown root ratio, that means the amount of horizontal or talking forces is reduced, greatly reduced, and the mobility of the tooth or root is also reduced. Next is you are minimizing the post-insertion visits because the patient has his own natural teeth. The amount of problems the patient face as in the complete denture, in order to orient the denture according to the upper and the lower upper and lower arches, as in the conventional denture, he has to come for number of visits when you compare it with overdentures. There less number of visits are required. Next is you can give if you are having a good stable and a retentive overdentures, you can also think of giving a roofless or an open palate like this. So it is much more comfortable for the patient and the patient acceptance is much better. Next you have the disadvantages. Now what are the disadvantages? Since the overdentures are taking support from the natural teeth, there is susceptibility to dental caries. Definitely they are susceptible to dental caries. Secondly, since you are preserving the natural teeth, there are chances that you may encounter bony undercuts. So they can be soft tissue undercuts, they can be hard tissue undercuts. So definitely you have to keep in mind. And because of these undercuts, the denture which you are fabricating over the natural teeth or roots, they can be either over contoured or under contoured. So if the denture is over contoured or under contoured, it may compromise on the aesthetic aspect. Secondly, when you are using attachments for taking retention for the overdentures, you require an increased interocclusal space, which may not be available always. So you have to figure out that and accordingly reduce the natural teeth so that you have enough space for accommodating the attachments, whatever you have planned. Fifth, as I told you, the over contour and under contouring can compromise the aesthetics. And sixth, since you have the natural teeth, they are also susceptible to periodontal breakdown. So next are the indications for an overdentures. Now we all know the overdentures, as in the definition also you are taking support from few teeth or one or more teeth. That is, you have to have few, whenever you are having few remaining teeth, you can always think of an overdentures. Secondly, if you have a younger patient who is partially edentulous and you are having very few teeth, so in those cases it is very much indicated, and you have to make sure that you preserve those teeth, never extract those teeth. Thirdly, in patients such as patient who are having congenital defects, like for example cleft lip and cleft palate patients, so in those cases you have to preserve those natural teeth, because those natural teeth are fine, and if you extract those teeth, definitely there will be a great loss of bone with the extraction of teeth. So definitely here it is a proper indication for giving an overdenture. Fourthly, in cases where the patient is having a high arched palate or V-shaped palate or sloping ridges are there, so in those cases, you know, the retention would be poor, the stability of the prosthesis would be compromised. So in those cases, whenever possible, make sure that you preserve teeth. Next is poorly defined sublingual fold. So in those cases, like in the lower arch, when you find that it is a poorly defined sublingual fold, you hardly have great amount of ridges, only one or two teeth are present. Make sure that you preserve those teeth, because you will get added retention and stability for your prosthesis. Never extract such a tooth. So always preserve those teeth, make an overdenture. The patient will be much more comfortable. Next is in cases where you have a complete denture which is opposing a natural teeth. So where you are having a complete denture, in those cases, if there is a root or even a single tooth, preserve that, because that will help in a better acceptance from the patient. It will be having, you will have a better maintenance of the vertical height. Next is wherever there is an extensive bone. So in situations where you are having few natural teeth, so there will be bone in relation to those natural teeth, and in situations like this you will be having more bone in comparison to the edentulous span. Say for example the patient has undergone extraction for the other teeth long back, so there will be considerable amount of resorption and loss of bone in the edentulous area in comparison to where teeth are present. So always try to preserve those teeth, because that is definitely going to increase prognosis of your treatment. Next is since this involves, because that may also go for extraction in a later stage, so you have to have a cooperative and a motivated patients. So these are all the indications for an overdentures. So next is the contraindications. Now contraindications, it's very important to understand this. Contraindications in an overdenture is in a patient who are physically or mentally handicapped or challenged. So in those cases, you have to make sure that you provide some kind of a fixed prosthesis rather than a removable prosthesis, which is difficult for the patient to handle them and maintain them. Secondly, an uncooperative and unmotivated patient. It's better to do a treatment which suits them. Thirdly, in cases where you have a reduced interarch space, I already mentioned that if you are planning for an attachment, so you require a interarch distance or interarch space. So if a patient is having a reduced interarch space and you are bounded by a severe undercuts, so in those cases also it is a contraindication. Next is when the remaining natural teeth are having grade 3 mobility. So in those cases, that means you hardly have bone, so it's better to extract such teeth or root. Next is, fifth is soft tissue and bony defects which cannot be surgically corrected. So in such cases also it is a contraindication to do a overdenture. Next is when you have a vertical fracture of the tooth. Say for example, you have a molar tooth and there is a vertical fracture which is going deep, say to the furcation area. It is better to extract such a tooth rather than preserving that and making an overdenture over it. Next is mechanical perforation of the root, or you have perforated the root canal when you are doing an endodontic treatment of the natural tooth. So in those cases also the prognosis becomes very poor. So in those cases it's better to extract the teeth. Next is the horizontal fracture of the root. When there is a horizontal fracture of the root which compromises, say the horizontal fracture is below the cemento-enamel junction, and it is much into the crest of the ridge. So in those cases also the chances are that you will be having a poor prognosis of your case. It's better to extract such a tooth. Next is the broken instrument into the root canal. So if you have done an endodontic treatment of the natural tooth and you know that you have broken an instrument which may give you a problem later on, it's better to extract such a tooth. And of course, tell the patient that this is what is being done. So we are going to remove the tooth and then you give a complete denture, or you take support from the other remaining teeth. So this is part 1 of our overdenture discussion. I will continue this with a part 2 discussion. Don't miss that. And if you have, and please like and subscribe to our channel. And if you have not pressed the bell icon, you can always press that, and you can comment so that I can answer to your queries and questions. Thank you for watching the video.